Okay everyone, so here we've got some of the equipment that we're going to be using. I just wanted to go through it in a bit more detail. These are the 5 adult cannulas that we use here in this trust. They run in different sizes, so the smallest adult cannulas are 22 gauge, 20 gauge, 18 gauge, 16 and 14. So depending on your patient, obviously we've discussed all those already, of what size cannula you put in. And you can see there is quite a variation in size, so a very short, thin cannula here to a very long, thicker cannula here. It all depends on what you're going to be putting through and at what rate you want to be putting it through. When we're actually putting the cannula in, we have these other bits of equipment here, and I'll just sort of go through the different bits of the cannula itself in a bit more detail. So when you first take the cannula out of the packet, it will be all curled up and ready to use. The first thing I suggest you do is flatten the wings down of the cannula so you've got nice flat wings there. Each cannula itself has a port, it's got some guards on it, and we'll go through those now. So there is a cover which covers the actual plastic tube of the cannula and the needle that's inside, and we can take that off and then we can see we've got the exposed sharp of the needle. It's important to take note that the needle of the cannula, for you to be able to put it in, sticks further forward than the plastic tube. So what will happen as you push the needle forward, the needle will pierce the vein, and then as you move it forward, the plastic tube will then enter the vein. That's a really important thing to remember when we're actually trying to get the cannula in the vein. If we follow the needle all the way back, we will follow it back to this point right here at the front here, and this part of the cannula is actually the flashback chamber. So when you pierce the vein with the needle, the blood will travel along the needle and will start to appear in this chamber, so you will know you're in the right place, and it will slowly fill as the needle remains in the vein. Here are the wings, so we use these wings here to stick the cannula down. Over here you've got a port. So this port's got a valve in it, and you can actually inject fluid or any medication through that port, but we only use it in 2 occasions: when it's very first put in, because we know it's sterile, and during a cardiac arrest. And we don't use it outside of that because there's no way to actually clean it and make sure you remain aseptic and non-touch. Back here you've got these lines here at the back of the cannula, and these are actually grip points where you actually need to hold the cannula, and we always advocate using a one-handed technique, so we grip our cannulas with our thumb and our middle finger here. Right back here you've got a plastic cover which you can actually put over the cannula if you want to, and this is very rarely used, only in very specific instances. Once we've got the cannula in the vein, we are going to need to actually take the sharp needle out of it, and all our cannulas are safety cannulas. So as you pull the needle out of the actual cannula, it will travel on the plastic tube, and then it will fall inside that white part that you can see, and then it detaches from the cannula and remains inside there. So this needs to go directly into the sharp spin. So obviously here our cannula will be on our patient's hands, this part would be in the vein, and what we need to do is, once we've got the needle out, we need to be able to attach our needle-free IV extension. Our needle-free IV extensions have one end which is a lure lock end, which this will screw onto the cannula and hold it in place, and this end over here is a needle-free connector that can be cleaned, and our syringes can obviously push into this or screw into it if we've got a lure lock syringe, and then we can give our medications down there. It's got this flexible tube on the end. So once the needle is out, we would then screw this on the end, and that will prevent blood coming out of the end of our cannula. And that will be our cannula inside the patient's vein. We obviously need to make sure that this sticks to the patient's skin, so we need to use our dressing to be able to do that. And with our dressing, we would first of all take one of these strips off, and we would then place it parallel to the cannula. We don't cross over or make an A or make a star with it. We actually just make sure that we put them parallel, because that means that we can then see the cannula beyond where we've actually pierced the skin, and we can see if there's any inflammation happening. Once we've got those 2 strips on, we can then peel out the rest of the middle of the dressing and dispose of that. At the back here, the dressing splits apart, and we can take out the backing of the dressing, exposing all of the sticky underside. Once we've got that, we can then hold the dressing, and it's very difficult to do with gloves on, but try your hardest. and we would want to make sure we open the cannula, so try and split it open and bring that split all the way to the coloured port, and then stick the back of the dressing down. We can then lift the cannula slightly, just ever so slightly so it doesn't hurt the patient, and try and cross the legs somewhat underneath the front of the cannula so that we can close the front of the cannula there, and then take the edge of the cannula off and smooth it all down so it's nice and stuck to the patient. Last but not least, we've got a little section here on the outer part that's got a picture of a person and then the space for a date. If you're really proud, you can initial there. If you're not so proud, then don't worry about it. But always write the date that you put the cannula in, so everyone knows when it can come out. And stick that at the side of the dressing so that everyone knows it's on the dressing there. And that's making sure your cannula is stuck down.